Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of the Common Sense MD. Today I have my beautiful daughter Kelli, who is our lead esthetician. You can't do a longevity practice, anti-aging practice without looking good as well as feeling good from the inside. You need to look good from the outside. And that's Kelli's department. She does such a wonderful job with it.
I mean, what's the largest organ?
That's right. Your skin is the largest organ. That's right. And really the most common type of cancer is skin cancer as well. Mm-hmm. So you need to be screened for that. But in any event, the reason we're doing this is because it's fall, back to school. You know, we've already damaged our skin in the summer. Mm-hmm. So I want to go over a few basic principles of things you can do to make your skin look really good. You know, I've had a problem with my skin through the years, and here I am 70 years old, and I get compliments on my skin now for the first time in my life because of you and your direction, things you do to my face, and the product. So I'll tell you where I stand as far as, you know, as a man, we don't do that much to our skin. At least most of us don't. We need to, because your skin, you know, people look at your face, and your face ages, and you need to be able to look good. So in any event, what I decided last year really was that I need to wash my face every night, which I never used to do, and with a really sensitive type of soap, a cleanser that you give me, and really need to apply basically three things that I focus on. You can tell me others, but vitamin C serum. Mm-hmm. I put on at night some form of retinol or retin A, if you can tolerate retin A, otherwise retinol, and then a moisturizer on top of that. Remember, you go from thin to thick so that it'll hold the moisture in your face. And again, I will tell you that if your hormones aren't balanced and you're not eating right and you're not getting your sleep, your face is not going to look good. So you have to do all that other stuff first. And I know my regimen is very basic, and yours is very advanced. So there's some new things. Talk to me about, number one, am I right in those basic three things? And sun protection for your skin.
Yes.
That you don't burn your skin. I'm not against the sun. I love the sun, vitamin D, all the other benefits of the sun. But really, it can cause aging skin. It can also cause skin cancer if it burns. So tell me kind of your ideas about this.
Well, you do have that right. Vitamin C and vitamin A, that's your retinol, your retin A. Vitamin C is in the morning, and that's going to protect your face against pollution, environmental aggressors, stress, heat, and it's going to suppress the melanin in your skin so you don't get the H-spots, sunspots. So that's very important to put on first thing after you cleanse in the morning. Followed up, you know, with, you could do like a tinted moisturizer for women with SPF, or if you're more on the dry side, a moisturizer and then SPF on top. And then at night, you want to start out with maybe once a week with the retinol. And you don't need to be on a retin A unless you've got really acne-prone skin or leathery skin. You don't want to tear your face up for no reason. So start with a low-grade retinol and then build up. And I'm not a believer in doing that every single night unless it's like mixed with a cream. I think the Obagi has...
that's the one you gave me.
Yeah. So that's safe to use every night because, you know, it's got a slow time-release retinol. But if you're just doing straight retinol, you need to start with once a week and then every 2 weeks build up. So
that one you gave me, the Obagi, is the only retinol I've ever been able to use because my skin is very sensitive. I'll turn red. I look red. It doesn't look good. Mm-hmm. So that is a good one. What's it mixed
great.
with? What else is in there?
It's got peptides in it, which is really big. It's not a fad, but peptides are very important, and it's important to have medical grade peptides because you don't know where the other stuff's coming from. And I would do a hyaluronic acid if you're on the dry side, crepiness, because hyaluronic acid is injected in fillers. So it's going to attract moisture and water, and it's going to help plump the skin.
Interesting. I need to get some of that.
Yeah. So, and then you would do that. I do that at night, but you can do it during the day too. It just depends on, how dry you are, but it's going to prevent crepey skin and it's going to help fill that in too.
Crepey skin looks terrible.
It's, yes, it's terrible.
I look at somebody's neck also.
Oh,
So you should use it not only on your face, but on your neck as well, right?
Hyaluronic acid is great on your neck. I like a neck cream though. We've got some good ones because the collagen on your neck is different than on your face.
It's more crepey, isn't it? It's thinner.
It's about as thin as your eyelids. So you want to use, you could technically put your eye cream all over your neck, but that's expensive. So there are great neck creams, and you want to look for collagen 7 because that's what you need for your neck.
Whenever I'm looking at a newscast of older women that are gorgeous in the face, you can tell by their neck how old they are. Mm-hmm. A lot of times, too, they have these platismal bands that I like to shoot Botox in certain people. It really works to relax those bands because if you have, and I have them, I need to do it myself probably, but if you can relax those and your neck can have a more smooth appearance, you should do it. One thing that bothers me about sunscreen is that, number one, you should use the mineral-based sunscreens, not the ones with all the chemicals in them, because they're probably worse than using nothing. Mm-hmm. But they need to have zinc in them, or titanium dioxide, is that what it is? Mm-hmm. But when you put zinc on your skin, you look white and pasty. Is there any way to avoid that besides putting makeup on? Men don't wear makeup.
You can avoid that. There are the tints that we have in some of ours are just kind of adhere to your skin color. So it's not really like a makeup look. But we do have some sheer ones that hide the zinc look really well. I think that Revision has a really great one. It's the True Physical Clear with SPF 45. That's a good one. But keep on the sunscreen. You've got to. Even, in the house, looking at your computer, those rays are getting onto your face. You've got to wear sunscreen every day.
So the basics we've kind of covered. There's some new things, aren't there? Like these new, a lot of people that see me, I get them to lose a lot of weight. Of course, you have the new GLPs, GIPs that we use a lot, and really, to me, they're the most important discovery of this century as far as medicines go. But a lot of people get their face. Most of the time it looks great, but sometimes it gets a little hollow. Isn't there a new product that came out?
We just got this product in. It's called VoluLift, and it's by Image Skincare, and it is for the GLP-1 users because as you lose weight rapidly, your face is going to...
That's the first place I notice somebody's lost weight.
Right, because where you lose it typically first. And then once you lose that fat that you don't want, it's kind of hard to get it back.
You don't want to lose, yeah.
Like the fat in your, you want to keep, so it's basically keeping that fat, that good fat in your face, and it's helping plump and lift.
Sometimes, though, when they lose the weight with the GLP-1s, you can finally see the angles in their face. Mm-hmm. If there's some way you could keep the cheeks plumped up, but the jaw and neck looking lean. Mm-hmm. And is that what the product, so the product you have, you just put it on the cheeks?
No, you put it everywhere.
Oh, okay.
Everywhere, because you're going to sag from here all the way down. Also, a great body cream would be good. You're going to get saggy skin. You can just tell when people lose a lot of weight rapidly. It's not a cute look. It's very cryptic looking. So you really want to make sure that you're doing procedures like microneedling, RF microneedling. Something's going to lift your skin while you're losing the weight. Ultherapy is a great thing to keep your chin and your jawline nice and snatched. And that's not going to kill any fat cells like some people say, but
I think that Ultherapy is the best thing you ever did on me years ago.
Yeah.
Really, if you can see the before and after when she did Ultherapy on me one time, it's pretty amazing. It just tightens everything up. Mm-hmm.
It's definitely the number one lifting device, and it depends on who does it, how you do it. It's really great. I swear by it. It's not going to replace a facelift, but it's going to help you prolong getting one. Or if you've gotten one, it's going to help keep that collagen in there because you want to keep building collagen.
It's
That's the
pretty
goal.
technical, isn't it? I mean, don't you have to get down to that smaz, what they call it,
Yes.
the right layer, or it won't work right?
Yeah, so I'm able to see where that is on the ultrasound, and then I'm able to choose the depths according to that.
You know, one thing I found is that when you get older, you lose bone, especially women. And bone is what supports the structure of your face. So I think hormones are important as well as estrogen. Gosh, estrogen is so important in women's faces and their skin.
I can
People
look
don't
at
realize
someone
that.
and
Their
tell
hair.
they have no estrogen. I can tell you need hormones because the procedures are going to work better. If you don't have hormones, you're not going to, like you talk about, lose weight. You're not going to look, everything's going to dry up. It just looks terrible. So that's the number one thing I tell people that come see me. You know, have you had your hormones checked if they're around that age?
Along with everything, all the other beneficial effects. And finally, you know, women are getting educated about using bioidentical hormones. You know, there's a whole generation of women that have been denied hormones because, number one, nobody knows about bioidentical hormones. Probably 5% of eligible women in menopause are on hormones in this country. And what it's led to is early heart disease, bone loss, dementia, misery, weight gain. And, you know, most people are scared of them because of the fear of breast cancer. But bioidentical hormones do not cause breast cancer. In fact, they prevent it, if anything. Also preventing heart disease, stroke, dementia, osteoporosis, and the women feel better. You can almost tell a woman that's on them by their energy levels.
100%. And their attitude. If you got a bad attitude, I normally ask if you have had your hormones checked.
Yeah, that's a good thought. I never thought of that way. It'd be hard to approach some women that way, though, wouldn't it?
I have a technique. Just, you know, hey, you seem like you have a really bad attitude. And you're not going to get far with that because what you tell yourself is how it's going to be. So if you say, I'm not going to, you know, I want my face to be up here and it's never going to get up here. Well, then it won't. But if you believe that it will, it will. So get your hormones checked and quit complaining.
And address your diet as well, because if you're eating a lot of inflammatory foods, not getting sleep, you're not going to look good.
No. So you got to start internally, and then even if you get Botox, fillers, you still need great skincare and you still need to do something to your skin. I tell people every 4 to 6 weeks, I get a dermaplane, get a hydrofacial.
What about microneedling? What do you put in there in your microneedling? Do you use any of the peptides or anything?
So exosomes are great for right after microneedling.
Exosomes, okay.
It'll heal your skin faster, and it'll produce more collagen than just the regular microneedling. But we use the RF microneedling, so that's going to help lift as well. So
I put collagen in my coffee every morning.
Yes, that's a good thing. And people ask me, is that going to, is that doing anything? Yeah, it's doing something. It's not going to, make you look 20 years younger, but it's everything together that's doing that. The hormones, the skincare, the, weight loss, the everything.
So you've got all these great machines that actually work, and I've seen your before and after, and they're amazing. Even some specific fat loss machines that it's hard to target a certain area, like around your middle belly, etc. But you have two different, an ultrasound and a laser, that really work well for that. You have done such a good job. I'm so proud to work with you. You make
Thank
people
you.
look beautiful. Even some of the men look way better than they would otherwise. So keep up the good work. There's always something new coming along.
Yes.
Any other words of wisdom before we leave?
Come see me. I'll analyze you and get you on a program.
Thank you, guys. We'll see you next week.
Thanks.